And then go ahead, Peggy, then Ralph.
Hey, Miss Peggy.
Hello, hello, hello.
Hey,
You
how are
know,
you?
turmeric. I know what turmeric is. It's basically what an anti-inflammatory, but my turmeric oil, best how internally or just breathing it or both or what?
What are you trying to use it for?
Well, I think it's an anti-inflammatory, isn't it?
Yeah,
I,
but like, are you treating something specific or are you just doing something general?
general and specific, I seem to have a lot of mucus, and so I read the mucus thing that you did recently, but I see my turmeric and I thought I bought turmeric for a reason. And so I'm thinking anti-inflammatory is what I was
Yeah,
thinking.
and inflammatory, I mean, it's good for sore throats, good for the brain. A few drops internally, 2, 3 drops is good. It's also very good topically, like if you have like arthritic issues or things in the joint. If you have like a sore throat, gargle or a couple of drops rubbed on the back of the tongue, a lot of times will knock out the sore throat. Um, Mucus. Yeah, I mean, you could try it there. Um, I'd probably use other things, but like, especially if there's a lot of inflammation, I mean, it could be helpful with the inflammation. Um,
Well,
rosemary verbena or helichrysum, even things like the yarrow and chamomiles and things like that might work a little bit better, but
so the
yeah.
back of the throat really isn't sore, but
Mhm.
I think coughing up the stuff, it's kind of
Oh, I see. Yeah.
slightly raw back there.
Yeah. Do it as a
Not bad.
gargle. Do it as a gargle.
Oh, as a gargle.
Like, yeah, do 2 or 3 drops and do like a little bit of pulling and like lean back and gargle a bit. Yeah,
Okay.
that should help that.
Well, I really like the smell of it too. I was
Oh
just
yeah,
breathing.
turmeric's nice. Yeah, yeah.
Thank you guys. Thank you
You're
very
so
much.
welcome. How long's the mucus been going on, Peggy?
Oh, going back to uh um a while, a while. What the reason is the cardiologist shifted my med to keep my cardiac rate and rhythm normal. But when I started having all this mucus, I looked it up and it's not supposed to be used for COPD. And 30 years ago, I had a diagnosis, but I haven't had a problem with it in a lot of years. And so I have to get a new cardiologist, and I'm
So,
hoping he'll make it the beta blocker just for that, not where it's affecting my lungs.
so one of the best oils for COPD uh,
Yeah.
is German chamomile. Like in
Yeah. I've got it on order. I think it's in the
yeah,
mail.
yeah. So inhalation and internal on that. And so if you do you have what do you have? Do you have like yarrow, you have helichrysum, you have
Yes. I got both of those.
one until the German chamomile gets there, why don't you do inhalations with yarrow?
Okay.
Yeah,
Easy
like
to do.
that will help ease the COPD and the inflammation. The German chamomile will definitely work better, but it's still what you can use until it gets to you. And then still do the things that we talked about with the turmeric and everything. And, the mucus.
It's clear and frothy, and it
Is
takes
it
a
just in
lot.
the nose or is it in your
Oh
lung?
no, it comes up from the bottom of your lungs. It's
Okay.
I have a old I have a concave sternum, pushes on the left lower lobe, kind of closes that off. And then I had RSV in the early 90s and wiped out my right lower lobe. So this looks like atelectasis, one on x-ray, but the medication has activated the COPD to the point of, yeah.
So let's have you do everything that we talked about, but like let's just explore a couple of things that you have. Do you have terebinth?
Yes, I do.
Rub it on your sternum.
Okay.
Like 1 or 2 times a day, rub it on your sternum. And
Okay.
the idea is also just like when I look at you know, there's there's the functions of the respiratory tract, but then skeletal muscles also are involved in elevating the rib cage and all of that. And you have a glitch on the sternum itself. Like, you know, it's not necessarily in muscles like the pectoralis minor here or the sternocleidomastoid, or, you know, a big one can be the serratus anterior, which is like on your side of your body, the side of your
Right.
ribs. All of those are usually ones that jump out more, but you know, probably because of that concave sternum,
Yeah.
you have like bound up fascia on the sternum. You know, it's not a muscle, it's just the fascia. But if you open that up, I mean, it's not going to be a game changer, but it will just
Help a little.
yeah, it will help a little bit. It will make it easier to take a deep breath to cough things out and ease your breath. And do you ever feel like pressure on your sternum?
A little pressure,
Yeah,
yes.
definitely do the
Sides as
Turmeric.
well.
Yeah. What's that?
On the sides as well. You know how you have us turn to side, and
Mhm.
that'll get me coughing too. So that those muscles on the side of the rib cage are also involved to a degree.
Throw a little terebinth over on those sides too, like whatever you
Okay.
can reach. Yeah, but
Okay.
definitely the sternum. And then let me know how that feels in a few days or a week.
Okay. I will. You're so sweet. Thank you. Thank you.
Yeah,
Thank
yeah. You keep me posted.
you. Okay. Thank you very much.
You're so